Okay. So here we are. Thank you so much for coming today.
Welcome, everybody. My name is Paige Fairbanks-Gunn, and I am the regional manager for Kelch Senior Communities in Arizona and Colorado. And I think it's extremely important that Pam and I we've worked together for going on 3 years now, and we feel that it's extremely important for our communities with Kelch Communities and for Pam to host these webinars on a monthly basis. This is really for all of you. It's a place for you, all of you, to come for questions and to help support you. This is a difficult journey. We understand that. We have been through this with families, and Pam has been through this personally. And I have too. You have been through much longer, but this is a difficult disease process. And we want to make sure that you are getting the information and that you are informed. We are your support team. So please ask questions. We're here for you and to help guide you through this.
Great. Thanks, Paige. I appreciate that. And thank you to you and to Kelch Communities for sponsoring this webinar, because it is such important information. I'll tell you, every time that we do a webinar, I sit there and think, wow, I wish that we were in a situation where we had that kind of this type of information back when I was going through the journey. So definitely, I hope you guys find this valuable. Now we are using slides, so just a heads up, we will pop back in and out, but we figured that you would want quantified information. I will summarize these slides as well as share the recording and send you guys the link, probably not until Friday or maybe even Monday. So you will get the recording, you will get the link to the summary of the slides. But for those of you who don't know me, I'm Pam Ostrowski. I am a dementia care coach, caregiving coach, and guide and consultant. I work one-on-one with families to help you through all those emotions I mentioned, the fear, the overwhelm, the guilt, all of those things. And so that is my role in making sure that you are able to make the best decisions possible for yourself and your loved one, because that's also important. A lot of times we don't think about ourselves when we go through this journey, and it's very important to put the me back in dementia. Okay, now let's talk about the situation we're in with what's happening in the world today. And I mean about Alzheimer's and dementia, not everything else. We'd be here till tomorrow. But really, as we age, right, as the population of Americans ages, and this is happening all over the world, as we all hit 60 or over, the safety and well-being of our loved ones are becoming top of mind, big concerns. And so with over 100 types of dementia, a lot of the neurologists don't know exactly what kind of dementia your loved one has, but they know that there's definitely symptoms there. I want you to remember that dementia is a condition. It is a condition that is demonstrated by signs or symptoms. It is not a disease. The diseases make up dementia. Alzheimer's disease, Parkinson's disease, any of the other ones that you are familiar with. But that from a numbers perspective, Alzheimer's makes up 60 to 80% of the types of dementia that people are most frequently diagnosed with. Keyword there, diagnosed. Now, the current trend is that 1 out of 9 people 65 or over have been diagnosed with dementia or with Alzheimer's specifically. And Layla, can you do us a favor and turn off your camera? I don't know why you're showing up like that, but we can, there you go. Thank you. So obviously the other half of that equation is that 1 out of 5 people as of 2029. So 5 years from now, when you look around, 1 out of 5 people will be 65 or over. So you put those two bullets together and you realize that we are going to have to figure out how to cope with dementia and from the stages perspective and transitioning from one stage to the next and understanding the symptoms. But more importantly, how do you respond to that? How do you plan for that eventuality potentially? Now, dementia is not a given, so I don't want anybody to get the wrong impression that, oh my gosh, we're doomed. But it is something that we want to be aware of and to take better care of ourselves as time moves on. It's also important to understand that the average Alzheimer's journey, when we're looking at memory care after diagnosis, it's 4 to 8 years. That's how long most people are living after the diagnosis. And if you're in memory care, in the memory care community, it's at least 400, that's a $400,000 journey. I know that we personally did private pay, and we ended up paying about $400,000 between my mom and my dad. My dad had vascular dementia, and mom had Alzheimer's. So it's an expensive journey. And we also need to figure that problem out, but that's a different presentation. So let's talk about the stages of dementia. This is kind of an overview. There's preclinical stage, okay? So the catch to this whole thing is that changes happen in the brain very early on. And so someone who has Alzheimer's today at age 85 actually was primed in 20 years beforehand. So 20 years before the symptoms start, the disease starts. It just takes that long for you to start to see the degradation of the brain cells being killed off and the amyloid plaques and tau proteins taking over. So how do you avoid this if you're in the preclinical stage, which pretty much all of us are, is eat clean, stay hydrated, exercise your body and your mind, and reduce your stress, and get plenty of sleep. Okay, so that is the prescription for almost every disease out there. So I guess they're serious about this, right? So take care of your body and your brain, and it will do the same. So the stages are mild cognitive impairment, early stage, mid stage, and late stage. I know that several of my clients have said, oh, well, my mom's in stage 6. And I said, there is no stage 6. So if you're reading something that says, oh, well, here's the 6 or 7 or 8, 9, 12 stages, there's no such thing. What that person has done is broken down the generalized symptoms and said, here's how we're gonna box them into these categories. And in reality, every journey is different. And so we know for sure that this is a safe breakdown. And you will hear mild cognitive impairment broken down as MCI, or abbreviated MCI. And what we're going to do for the purposes of this presentation is we're going to talk about those two together, although they are typically, when medically, they are typically slightly different. Usually you will not know if someone is in mild cognitive impairment. You will notice the early stages, and we see most people come into this journey at early stages because no one else has noticed that they've got problems, that they're having difficulty with numbers and talking, and we're going to go through those symptoms in just a minute. There is such a thing as pseudo dementia, and these are the elements. And for the slides, because we have a limited amount of time, and we can do another one of these where we break down each stage one at a time. But for the purposes of an overview, these, I won't go through all of the slides in great detail. So we're basically, for pseudo dementia, you've got to look at nutrition, exercise, sleep, stress, hormones, supplements, and toxins. So air pollution is becoming a big influencer on our ability to breathe, our lungs, our oxygen getting to our brain. So a lot of these are things that you have control over. And that means that you could actually reduce significantly your risk of dementia. So let's talk about, as I mentioned, we combined mild cognitive impairment and early stage dementia. And here is the way it feels and looks. So while I'm talking about this, I'd love for you to put in the chat whether you or your loved one what stage you think they're in. It would be interesting to see what you think they're in now, and then look at throughout the presentation to see if the symptoms match up with the general stage descriptions. again, these are not hard and fast. We're not putting these in a box and saying that once you have this symptom, that pushes you into the next stage. But it is saying that these are the typical symptoms you'll see in these particular stages. So, for instance, remembering a name, it can be a struggle. They may have a problem with that. They're still living independently, but the difference is it's not just about not remembering a name. It's not ever remembering that name. Normally, your subconscious mind is trying to remember a name, and it can't pull it, it's on the tip of my tongue, but it's not. And so, 2 hours later, all of a sudden you're saying Tom Cruise, because the question was who's the star of Mission Impossible. So might be an inopportune time to yell that out, but it's all fun. So remembering a name longer term, recalling recent events, remembering where he or she put a valuable object, like where are my keys, where are my glasses, where's my wallet. They have difficulty making plans, so you'll notice that they'll start to depend on you more. Now, there's a lot more coming on these symptoms, so this isn't all we're going to talk about right here on this stage. They have difficulty staying organized, so a person who's normally very organized could be very messy. And then managing money, that's a really big deal, where they start either spending a lot of money, or they don't know where their checkbook is, or they don't know where their credit cards are, all of those things. So this is also the stage where they know that they're having problems. They're very much aware that something's wrong, and it gives them anxiety, or it gives them depression, or both. And so if you start to see those types of symptoms, then, it's time to have a conversation. And I always say sooner is smarter. So let's talk about how communication works at this stage. So the symptoms you might notice are someone you are answering the same question over and over again. They're asking the same question over and over again. What time is my doctor's appointment? What time is my doctor's appointment? Or it could be anything. When are we having dinner? And so this can be really frustrating for you because nobody wants to repeat themselves. However, you have a choice. You can either say, what, you could write it down and show them. You could get a clock and use that as a visual, or you can leave the room, decompress, and then come back. And those are just, and we're not going to cover how you handle all of these things necessarily, just a couple of bullet points for each one. But that's the biggest challenge to me in early stages, is the repetitive questioning. They also might be confused by your instructions. So if you're going to a doctor's appointment, you go to pick them up and they're still in their pajamas. You could say, I told you our doctor's appointment is at 10 o'clock. I pick you up at 9:30 and you're not ready. And they'll say, my dad would say, you didn't tell me that. And so, we get that level of resistance because they have lost their temporal capability. They don't know what 9:30 means. And so you have to think of different ways to address that, or show up early and help them with, hey, I came over early. We're going to go to the doctor's, let's put on our shoes and, let's get you ready, and you have to be really careful because you don't want to sound like you're treating them like a child, because they've lived a full life. And we always need to show our loved one, in this situation in particular, kindness, compassion, dignity, those types of things that are so important to being human. So how can you help? You may have to get creative. That's the bottom line. When you're talking with them, you may have to figure out different ways of saying the exact same thing. And when you make requests, you have to show, don't tell, because they can't, the word processing capability is one of the first things that goes specifically with Alzheimer's. So, and the other thing that typically goes is tasks, being able to do complex tasks, like, read a recipe and understand what that means. So those are important things to keep in mind. They're not, and I had one client who's like, I think he's doing it on purpose. And I said, no, I don't think he is. it just feels that way to you because it's so frustrating to be part of this. And ultimately, if you're feeling frustrated, the best thing you can do, they're not going anywhere. Just go into a different room, walk outside, listen to the birds, do anything to get yourself out of that environment, because it can be very difficult, and you cannot bring that anger back in because it will serve no purpose. And frankly, I've seen relationships harmed because of that frustration and anger. So, you have to remember that this is not their fault, and that we have to be patient with them. Now, in this case with mild cognitive impairment in the early stages, most likely they're still living alone. So some of the symptoms are they don't remember where things are. They don't remember where the plates are, the silverware is, they're losing items, they're not taking medications as instructed, which is dangerous. They either are overdosing or underdosing. So any other complications from other diseases or afflictions like high blood pressure or diabetes can be exacerbated and then add to the dementia symptoms. So we really need medication management is so important. And Paige, that's something that you guys manage at an assisted living level, correct? Oh, you're on mute.
Absolutely. Absolutely. Yes,
Yeah.
we manage all of that.
Yeah. And the nice thing is both at assisted living and at memory care.
We have nurses.
Right. So
and do our medication management.
And are they there in case I need something at 3 a.m?
They absolutely are. They're on site 24/7 hours a day.
That's so important to have access to a medical professional 24/7. It was to us. It's not important to everyone for some reason. I don't understand it, but it's true. I've had people tell me that. So they also lose track of time, which we mentioned, and these are the different ways that you might be able to help. So you want them to maintain as much independence as possible. Nobody wants to feel dependent on another person. So but they still need stimulation. Sitting at home in front of the TV is bad for them. It's bad for us, by the way. And so being able to go out and meet with friends, go out to a concert, audible stimulation, sniff flowers, so have flowers around or candles. Any of those things are all it's the brain that processes all of those things. So if you have a loved one who sits in front of the TV 8 hours a day, that's going to exacerbate the dementia symptoms. And so again, we can talk more about this in another webinar. How do you get the person off the sofa and away from the TV and get them engaged in other activities? So we can cover that at a different time if that's what you want. Just put it in the chat if that's what you'd like us to talk about. And the other thing is to invite family and friends over to play a game. So learning a new game, whether it's a card game or a board game, you're just going to have to be prepared to maybe repeat yourself on how the instructions, how you use the instructions, how you play the game. Maybe you have one of the things, I'm not good with playing cards. I'm not good at it. And so everybody has to have an open hand, at least one round of open hand for me to figure out what it is that we're doing. I don't know why, it's just something the way my brain works. And so you could do that, something like that. You can write short notes, Dr. Hart, 10 a.m. Tuesday, and then have a big calendar in every room so that wherever they go, they're reminded. And then, the doctor's appointment should be, maybe their shape, a heart, or they're red. And then green is we're going out for lunch, so ways to kind of have, and then have what each one means on the bottom or sticky or something. And these are just different ways to handle the mild cognitive impairment and the early stages of Alzheimer's or dementia in general. Again, these all apply to generalized dementia diagnoses. One other thing that I wanted to mention, and Paige, I'm sure that you pay attention to this too, is lighting. So as we get older, our peripheral vision narrows. And so the amount of light that your eyes take in is less. I don't know about you, but if I have to read something, I've got to take it over to the lamp because I can't see it if it's at a certain distance. And so put in brighter lighting at the very least. This is going to reduce your fall risks, and pick up carpets, loose carpets that can be tripped on. Those are all things that as we age, let alone have dementia, that we need to address. The next symptom that's part of this is around eating and drinking. So you might see, and this is kind of, like I said, it's early stage. We see it a lot in mid stage, but it can start happening in early stage where they don't remember what they ate or if they ate. My mom, so we had a 14-year dementia and Alzheimer's journey with her. And I would say, whoa, did you go for lunch? Yes, we did, because they always did. And then I said, what did you have? And she's like, oh, I get the same thing every time. That's something to watch for too, is they have like a dozen go-to phrases. And she played me. I didn't realize it till later that she knew that she didn't know what she had for lunch, but she wasn't going to let on, so you have to kind of ask more detailed questions. Paige, did you run into that too?
Oh, we run into that a lot, especially in our memory cafe. It is a lot of that, and especially for families that are out of town. And it's, what did you do today, Mom? Oh, I just did the same thing, watched TV and visited with the neighbor. Well, what TV show did you watch? And which neighbor did you talk to? Then you start to dig into those details, and it's really hard sometimes for them. And so those are some very good signs.
Yeah. And then the other thing is dehydration. We mentioned hydration earlier. Like my dad, hardly ever, you'd never see him drinking water. And the brain actually starts to collapse on itself if it's dehydrated, which causes fuzzy thinking, inability to focus, some memory loss. So one of the things that part of this webinar is how to recognize the symptoms of dementia versus pseudo-dementia or dehydration symptoms. So it's really important that you don't jump to the conclusion that, oh my gosh, I've got dementia, or mom has dementia, or dad has dementia. Eliminate the easy things first. Make sure that they're hydrated, make sure that they're eating properly, all of those types of things. So basically, you want to check the refrigerator, you or someone else, every week. So my dad would always say, he wanted a particular fruit. He wanted peaches or he wanted raspberries, and I would get them for him. And I would put them in the refrigerator because they would last longer. And he would forget that they were in there almost immediately. And then the cleaning staff had to come in and remove the molded fruit because he didn't realize that they were there, and he didn't look. So again, it comes down to that they're not processing, hey, I want raspberries, I wonder if they're in the refrigerator, or Pam put them in the refrigerator. So there's this disconnect. Think of it as a veil in front of them, and that the world is happening around them, but they can't quite see it, feel it, touch it, hear it. Hearing is another thing we'll be talking about in another webinar about the effects that how hearing loss actually exacerbates dementia symptoms and can accelerate them. But also watch for weight loss or weight gain. It can go either way, because if they don't remember they ate, they'll eat again and again and again. And here's the other thing. If they have a dog, oh my gosh, that poor dog. They're going to end up gaining a ton of weight because, they basically are being fed multiple times. And that's a problem, because otherwise the dog would normally eat twice a day, and now it's eating 10 times a day. So watch for the dog. If there's an animal in the house, watch for whether or not they're being overfed. The other thing you can do to help with for hydration is you can take a bottle of water. It doesn't have to be the 24-ounce one, but line them up. And I know that this would be a daily thing. So it's a matter of what situation you were in, whether this is your spouse or partner, or whether this is a parent, or if you can bring in a companion or have a neighbor or a friend stop by. But when they have a visual reminder, very important, this is clear, because then you can see how much water you've drank. And a lot of people will try to use the different like Igloo and Hydro Flasks and all the fancy colored containers. You can't see how much fluid's in there. And so they just assume it's empty. They don't assume it's full. So get clear, clear water bottles or a clear, plastic container, and use that as a way to make sure that they're drinking. Coffee and tea are fine, they count. Lemonade and juice do as well. So don't be worried about that, as we try to get at least, I always say 48 to 64 ounces. There's actually a formula about that, that it's half your body weight, something along those lines. So, significant amount of fluids. So, and then lastly, we talked a bit about stimulation, but if they're sleeping in front of the TV, if they're always in front of the TV, if they get agitated in the late afternoon or evenings, or they're not sleeping through the night, they're not getting enough stimulation during the day. One of the things that my mom was at a Kelch community, Rock Creek in Surprise. She was up at 7 having breakfast. They got her up and dressed and ready for the day. And then she was busy with activities and snacks and movies and pet therapy and all sorts of things all day long until after dinner. They had quiet time, and then everybody went to bed. And she never had any signs of any sleep issues or any agitation in the late afternoon. So I know that people talk about sundowning syndrome, but in reality, I believe it's largely due to the fact that the person is just sitting around, and it's easier to leave them alone than it is to disturb them and try to get them, doing something and getting them stimulated. So, we mentioned some of these before, so I'm going to keep moving because we have a lot to cover still. And it's at the bottom of the hour already. Paige, do we have anything in chat that I need to know about?
We do not. No, everybody's pretty quiet. So
okay, well, I
put your questions in here.
4 chats. Oh, I got private messages. That's why. Covering how to encourage people to get out of the house at some point in the future would be great. My dad just mostly wants to be at home and is uncomfortable going to social functions away from home. I'm glad you brought that up, Julie. So the reason why that is because he knows that he has cognitive impairment, and it is so embarrassing for them, and they're embarrassed for their loved ones because they're worried that they're going to do something that is inappropriate or that makes them look less than whole, so to speak. And so don't create social functions for him to go to. Let's break him in easily and say, let's go outside for a walk, or even sit outside and have a cup of coffee. You don't have to leave the house, just leave the inside of the house, get away from the TV. You can even do a puzzle or play a game of rummy or go fish, whatever you want to do, but something other than watching TV. And if you want him out of the house, do something that doesn't involve other people that he might embarrass himself. Now that's him thinking that, not us, but you can see how they would be afraid. I don't want to look stupid is what I've heard a lot, right? They don't want to feel like, they've embarrassed anybody by not understanding what's going on. And that's a very challenging situation for them to be in.
It can be very scary.
And very scary, exactly. Because here's the thing. Most of us know that if there's going to be some brain issues and that we're having struggles, that it's not going to get better. But what they don't know is that there are things like pseudo dementia. Drink a 12-ounce glass of water. That's your first solution. Get out and exercise more. Get some more oxygen to that brain by moving around. That's why I said take him out for a walk. So that would be my initial suggestions, Julie. And again, we can spend more time on what to do with these symptoms on a different webinar if you guys would like us to do that. All right, so now we're going to move on to mid stage. And this is the longest stage, and it usually lasts several years. Again, and my mom's journey was unique to mom. We had 6 years of decline, cognitive decline, where we were paying attention. And then after that, she was diagnosed with Alzheimer's, and then it took another 8 years. But in the process, she lost her ability to speak 8 years before she passed. And then she lost her ability to walk 5 years before she passed. So she was full on care, and that was, we never, ever anticipated that. And it was really hard as someone who, I was very close to my mom. It was so hard to watch and cope with. And dad wasn't helping because he was angry, you know, that his wife had been stolen from him by this disease. So, you know, it's tough. This stage is tough. And unfortunately, usually, now not again, I know people who have had, you know, just had a 1-year journey, right? And usually the loved one feels cheated that their spouse or partner or parent passed away so quickly. On the flip side, someone who's gone through the 14-year journey, I'd rather have the shorter journey. But yes and no, right? It's you're between a rock and a hard place. I did get another question that said, yeah, cost of in-home care versus senior care.
I can do that one. That one's a lot. That one's a lot.
Yeah.
It's a good question.
Yeah, it is. Did you want to answer it quickly?
Sure. Well, to answer your question on that one, the cost of in-home care, it's really kind of on a spectrum depending on what type of care you are looking for. So the cost of in-home care, if you are going to be going with a non-medical home care company, which is usually like a certified caregiver, and you know they're certified through through the non-medical association, then you're looking at anywhere from about, probably on the low end, about $25 an hour, but today it's normally about $35 to $40 an hour. So if you have a caregiver through that caregiving service 24 hours a day, you're looking at anywhere from probably about $25,000 to $40,000 a month.
Isn't that insane?
Yes. Yeah.
And even if you did, let's say you do 3 days a week, right? So let's do the math really quickly. We'll say mid-stage dementia, we'll say it's $35 an hour. Now, if they need full-on attention, toileting, showering, and everything, it goes up to 45 or 50, by the way. So 35, and then let's say they do 4-hour shifts, or maybe 6-hour, because they don't like to move between 2 different clients in the same day. So even a 6-hour shift, and then do that 3 times a week, you know, you're looking at, you know, $630. So, you know, let me make sure I did that right. Times 6 hours. Yeah. So, and then times 3. Yeah. So $630 for a week, for 3 days a week. So this is the reason why we're seeing more and more assisted living and memory care communities being built and staffed, is because, you know, Paige, you want to address how much that costs for assisted living, general ballpark, and a memory care per month?
The national average for a assisted living memory care that is just focused on folks with memory loss and cognitive disabilities is about $7,800 a month. You know, that equates to less than minimum wage per hour. But it is an alternative, and it is usually at that time full care. It's not necessarily full on-site nursing care, but it is certified caregivers around the clock. But with home care too, like Pam said, you can piece that together. And in mid-stage, families do struggle with placing their loved ones. And if they're not ready, or they're, you know, for whatever reason, you know, they can usually piece it together with a few hours, you know, a few hours a day, a few times a week, because usually the minimum is 3 to 4 hours per day. So you can usually kind of band-aid those services and hobble along a little bit, but eventually, as the mid-stage continues to, you know, as it continues to go through the stage in the process, and unfortunately it does get worse, the more care they're going to need.
Now, assisted living, they could enter depending on, and again, this has a unique to every person caveat, is some people can go into assisted living, have a caregiver come in to help with certain things. And so how much is assisted living on average per month? Again,
average assisted living runs anywhere from probably about $5,000 to about $7,500, depending on care services.
Sure. Yep. Okay. All right. So hopefully that answered your question. And so let's keep moving on mid-stage. So you've had a chance to read this, but you know, you're basically looking at acceleration or deepening of the symptoms that we saw in early stage, where they're having problems learning new things. using the TV remote or using their phone. That's a big deal, right? That's the first one I see is, I can't call you because I don't know how. They may remember how to answer though. So the answer to that one is you call them. But they'll have problems with reading and writing, working out a tip at a restaurant. Like I went to lunch with my mom and we had that where I said, she's like, well, how much should I tip? And I told her how much. And she's like, here, you do it. And I knew that, that she couldn't. So, those were the kind of the signs that I started to pick up on where I could see where her limitations were. So, as the disease progresses, what Paige was talking about, they're going to need help with clothing. So picking clothing, right? Because they may put on the wrong thing. Most likely they're going to put on the same thing they wore the last 3 days. So because if they don't have someone there to notice, they don't think anything of it. And so a lot of times I'll tell my clients, when you lay out the clothes and take the dirty clothes and put them in the hamper, this is when the person's living with the caregiver. And so that's the only way, that they're going to be able to change clothes because they don't know that they wore it yesterday. That's just the fact. And then brushing your teeth, brush your teeth together because it's very much show and tell. And so it's a matter of you brushing your teeth next to them and make it a game, make it fun. Try out different types of toothpaste, do something that, this is totally turning your life upside down. I understand that. I did it. But it's also, if you do it right, it can be fun. It's just a different way of living your life as far as working with them and being creative and helping them still be happy, because ultimately that's really what you're trying to do, is help them deal with this disease in the best, healthiest way possible for you both. If you see that they're depressed or moody or withdrawn, that's also, men tend to have this symptom more than women, heads up. So you'll see that they might feel like they don't, like I think it was Julie mentioned that their dad doesn't want to leave the house because, we talked about why, but you can see that happening. And so you have to get creative about how to get them out of the house. And you don't have to put them in a social situation. They may not want to go to their grandson's soccer game because there's other people there. So have the grandson come over and kick the ball around in the backyard. There's lots of different ways to do these things. And I don't want you to feel like this is an insurmountable and terrible and ugly journey, when in reality it is undesirable, but there are ways to go through it where it's at least tolerable. And sometimes you can have great moments of joy and laughter. So
it's like shifting. You just have to shift your
there's
behavior.
a shift. Exactly. Yeah. So for living arrangements, quickly, we'll just go through, they basically don't know about unsafe behaviors. And then there's things that they're usually afraid of, which is the shower and the shower head. So the water coming at them is scary. So the likelihood of them not wanting to take a shower is very high at this stage. And so you're going to have to figure out how you want to handle that. You could help them with a bath, or you can put out a washcloth and a bar of soap and they can do the spit and polish way of keeping clean in the important parts. Mobility decreases. So that could be falls and potential injuries. They're disoriented. If you're used to having them over to your house, or, you have siblings and, mom and dad are going to come over and visit, they may not know where the bathroom is anymore. And so it's really important to make sure that you show them once, maybe take a tour around the house every hour, see how everybody's doing, and say, do you need to use the bathroom? And if they get upset with you, so what? At least you're making sure that they're oriented. And that's a tough thing for most people. You figure they're fine, right? We assume they're fine and they're not. And they need that additional care and attention. They may want to stay in bed and not get out of bed. Don't want to get out of their PJs. They're very comfortable. You should go away. And so again, there's some things that we can do. One of them is to get an in-home dementia caregiver, someone who's certified and trained in dementia, as far as, what the symptoms are and how to get creative. And they can show you some things too, some tips, and make sure that your home is a safe place. Communication is one of those things where you may say something and you're going to get met with a blank look or resistance. I don't know which is better, but you get one or the other typically, and you may get upset and say, go take your shower, but it means nothing to them. So again, you're going to have to get creative, change your words. Let's go get washed up. Or, hey, did you see where the soap is in the bathroom? Let's help me find it. Find ways to engage them to help you help them. And that way they feel more involved in the process. Otherwise, you sound like you're parenting them, and they will not tolerate that. That has never gone over well, I will tell you. So it's a matter of working with them. And frankly, I've had people say, oh, well, I stayed in the spouse stayed. So I stayed in the bathroom with her while she took her shower. And I said, would you normally do that? And he said, no. And I said, so, and she's uncomfortable taking a shower. So maybe you let her be a little bit by herself, or you get a female caregiver in there, because it's awkward. They know when you're doing something unusual. So you don't want to put them in an uncomfortable position. If you look at your behavior and say, this is the way I would treat my 5-year-old, you're doing it wrong. Just straight out, you have to change your behavior, because this is an adult. And most likely, if it's a parent, they are not going to take that from their child. There's a relationship that is at the core of every human, and the humans keep track of their relationships. If nothing else, they keep track of their relationships and the pecking order. So something that you want to keep in mind. Be careful of taking their words at face value. They may say their stomach hurts, but it's actually a UTI. They may start crying for no reason. It could be a UTI. So UTI stands for urinary tract infection. And so you have to check in with them and say, well, where does it hurt? And start touching them and saying, is it here? Is it there? And it could be a variety of things. So they're searching for words that they know, but they aren't necessarily the words that they mean. And that is really hard to differentiate between. And initially, in the early stages, when this first starts to happen, you take them at face value, and then they turn around and look at you like you have 3 heads. Well, why are we doing this? And it's like, well, you said X, Y, and Z. And they're like, no, I didn't. So you have to laugh, because otherwise you'll cry. So remember that you're still their child if you are an adult caregiver and having a parent in this situation. And then eating and drinking. Oh my gosh, sugary foods, Paige.
They love it.
Oh my gosh. I mean, it's just crazy.
Yeah.
It's the hot fudge brownie sundaes and the candy and everything. But bear in mind that they might have difficulty swallowing. So my mom lost her ability to swallow for 6 weeks, and it came back. So I guess that's the good news. Her ability to swallow came back. And so she was really struggling with, being able to eat anything but pureed foods. But you have to be careful with the foods that you feed them. And I wouldn't suggest pureeing when it's not necessary, because it is really perceived as you're treating them like a baby, and you don't want to do that. So, just pay attention, make sure that, small bites and lots of fluids around in case, there's an issue with swallowing. And then, so the things to do is, I had one family bring an entire bag of candy to their loved one in memory care. And I said, it didn't last more than an hour. And they left her with it. And it was empty when they got back from lunch. Yeah. And then she had an upset stomach the entire day. So you could provide sweet fruits, peaches, or, I'm trying to think of grapes, cherries, any of those kinds of things. But a bag of candy is just too easy to eat. So, just keep an eye on them. You're going to have to make sure that they're not pocketing food, where they know to swallow, they know to chew, but sometimes they eat more, put more in their mouth than they can swallow. And so they pocket. And then make sure that if you do have a caregiver, that they're monitoring the fluid intake. That is not a given. So make sure that that's happening. And then lastly, for mid-stage is the stimulation. It remains important. Stimulation never goes away as far as how important it is throughout this journey. So it includes, if you can get them to go out and do a short walk, go to the mall, to go shopping, or to go grocery shopping. That's always a good one. You know, just anything that stimulates them visually and auditorily, and even scent wise. So you go to grocery shopping, you can smell, you can sometimes you can taste if you're at Costco. You get a chance to see lots of things and hear lots of things. And it doesn't have to be an hour at Costco, or at your, you know, Kroger store or whatever. You can just go in, spend 15 minutes and leave. You've achieved the goal, which is stimulation. And then, you know, basically other things that you can do is you can reflect, you know, get out a book of photographs, or phones are hard because they're not big enough to see. So, you know, having a photo album or something like that is usually better, or print off big photos, big size photos, so that they can look at them. But whatever you do, when you're looking at something or talking about an event that happened 10, 20, 30 years ago, because they're going to remember long-term memories, not short-term memories. So short-term can be anything from a minute ago to, you know, 3 months ago or 6 months ago even. So try to go back 5 years, 10 years, you know, as far back as you feel comfortable, but never say, do you remember? That is, you know, Paige, I'm sure you hear people say that at the care communities.
All the time. Yes.
Yeah,
I have
it's,
to
you
correct
just want to
them.
say, you know, that's not nice. It's unfair to ask them that question, because of course they don't, or they might remember something. And that's the other half of that story, is when they remember something and you don't believe that's how it went. That's not how it happened. And then you hear the families arguing about, well, no, you know, Uncle Sam did not do that. Auntie Joe did it. And the loved one is like, no, that's not what happened. And then they're arguing about a memory, and neither one of them is going to win. So it's really important to let it go. Does it matter? You
Who
know,
cares who's right, right?
yeah. Would you rather be happy, or would you rather be right? So
Yes.
let them be right. Let it go. And so, you know, the other thing that you can do at this stage is to bring out things that are tactile or visually stimulating. So a favorite sweater, jewelry, because it sparkles, hats, shoes, cars, you know, like my dad was into modeled cars. And, you know, you bring them in and he'd take a look at them and he'd say, oh yeah, well, this one that has the taillights like this, and that one has I mean, it was amazing the stuff he could remember from 40, 50 years ago. You know, whatever it might be, you know, you can bring in a balsa wood, you know, airplane and throw it around the outside, you know, the yard, in the yard. You can do a lot of different things. They keep you both entertained. You're making new memories and they're happy because they're spending time with you doing something enjoyable. And that's really the goal here. But whatever you do, avoid letting them stay in the room by themselves. That's a bad thing. And then finally, late stage. Now, this one's really not fun. But let me check. I have another chat message. My mom enjoys putting family pictures in albums. See, that keeps her busy. She's looking at people's faces. That's really good. Okay, so late stage. There's a lot of things that could happen. It doesn't mean that they will happen. It's that they could happen. So you might have continence issues. You might have bowel issues. You might struggle with language overall. They can't have a conversation, but like my mom's favorite word was chicken. And I think it's because of the way it sounds in your mouth, chicken. And she would just say chicken, chicken. And it would make everybody laugh. And I think that's the other reason she did it, is because it elicited a positive response. And my mom was all about being positive. You know, they're going to need help with all activities. You know, a lot of times they can still feed themselves, but they can't do much else. Like they might not know what the knife, the fork, and the spoon are for. And so that's the reason why a situation like memory care is, it's a group sitting at a table. And it's kind of interesting to watch who watches whom. And if somebody picks up a fork and starts to eat their peas, the entire table picks up a fork and eats their peas. And so it's just so important to allow them the ability to mimic. That's why I said with the toothbrush, you brush your teeth with them so that they can mimic what you're doing. And that way they feel successful, and feeling successful during this disease is so important. You're giving them a lifeline when you do that. And so, think of it that way. They don't know about recent experiences. I know some families will go into the memory care room with the loved one and sit there and talk to them about everything that's happened in the past week, 2 weeks, month. And it's like, why are you doing that? Take them out of the room, walk around, look at the flowers, observe the environment, make comments, but they can't remember or understand who you're talking about. So if you're going to visit, make it worthwhile. And then watch out for UTIs and pneumonia and those kinds of things, because they usually can't communicate that. Speaking of which, they can sound gibberish, when they talk. It's not that they don't understand what you're saying always, it's that they can't respond. And what a horrible situation to be in, where, like, I said something about my brothers, and my mom, because she couldn't respond, tapped me on the knee with her finger. And it was just kind of that heads up of, she was still in there. She knew exactly what I said, and it was inappropriate to be talking badly about my brothers. So, so I got reprimanded by a woman with Alzheimer's for, 13 years at the time. So they're still in there, and you have to respect that. They are still in there. I know it doesn't feel like it sometimes, but they are still in there, and you please respect that. At this point, though, they need 24/7 eyes on care. They can get hurt. They can wander off. There's just so many things that can happen at this stage. And so either it's going to be a memory care community or a live-in caregiver or caregivers. You can do shifts if you want. But this is a disease where when you get to this stage, you have to make sure that they can't live alone. That's just not an option. Or they move in with
Safety
you.
awareness. Right.
Yeah, exactly. And that's the other thing to start thinking about is I'm going to my certified senior advisor conference next week. And one of the things that I want to talk to financial advisors about is, what if you have people who could sell their current home and pull together 2 homes, or have their home and then have an addition made, or a tiny house, or a tiny house won't work for a late stage, but at least, you've got accommodations. So there's lots of options, but you need to be thinking about them now, because you don't want to be in this situation and panicking about, well, what are we going to do? Needless to say, what Paige said about the cost of having a 24/7 in-home caregiver, that's a couple $100,000 a year. I don't know how many people can afford that. Not many. So, and then, memory care is, call it 84,000 plus medication and stuff, but we'll call it 84,000. And, that's still a lot of money. So, how are you gonna cope with that? Eating and drinking, you're going to see a decline in eating, and dining is going to become less important to them. You're going to want to, again, make sure that they're getting the stimulus and getting moving around enough that they actually are building up an appetite. So Paige, you guys have activities where, I mean, remember mom would they would just, push a ball around and that type of thing to get their arms moving. And there's other things that you guys have as well, correct?
Absolutely. And I think that's where a lot of families, come to us that are struggling with their loved one at home. And especially if they're still ambulating and there's just not enough for them to do at home, and they're trying to entertain them all day. So yeah, we have a lot of different things that go on, and we do dual programming. So we're able to do dual programming. We have, one activity department is going to be working with our residents that are more higher functioning. And then we have another activity program for people that, are more progressed in the stage, that are more progressed and are at a higher acuity, for the different levels. So for their transitioning, we're able to accommodate both and keep them busy throughout the day.
Yes, and active and stimulated. Yeah. So the thing that note here for the group is if you're looking at memory care communities, it's better for you to start your research early. But if you're looking at memory care communities, ask them if they have dual programming, because I would say my experience, personal experience with my client base is that majority do not. They like to call it person-centered care, but it's like, all right, well, tell me, here's my loved one. What are examples today of your current residents and how you're doing person-centered care? Because just knowing that they like cars and that they were a handyman as a career is not enough to change, to create stimulation. So make sure that you explore that conversation about the stimulation. And that's one of the differentiators for Kelsch, is that they have that dual programming where you have high functioning and lower functioning individuals. So for here, when you're at the late stage, honest to gosh, hold their hand, rub their back, rub their shoulders. Any touch is going to feel good. And
oil sensory massages with essential oils. They love that. Hand massages, foot massages. Yeah.
My mom they used to do a manicure with her, but they would massage her hands first. Yeah. Yeah, it's fun. And these are the kinds of things you want to ask your care community when you're thinking about moving your loved one into one, is to say, well, what do you do? And they may answer in a generic way. Push them to answer specifically, because as you can see, Paige is like, oh, we can do oil massage, we can do manicures, pedicures, foot massages. I mean, she's just rattling them off. So clearly that's what you want, as opposed to the generic answer. But you can walk, if they're ambulatory, you can walk around with them and point things out. Mom was in a wheelchair, so we would walk along the gardens that were in the back of the community, and I picked flowers for her. Didn't tell the Kelsch people I picked their flowers, but I picked their flowers. Truth's out, Paige.
That's okay. That's
good.
The
flowers, and then Mom would sniff them. She'd go. And she knew that's what you're supposed to do with the flower. Unfortunately, the flowers that were there didn't have any scent. So, because they're like lantana and, other desert flowers. So they didn't smell. But she knew that she was supposed to smell. It was so funny and cute. And she thought it was funny. So those are the moments you live for. That is now 9 years later, making me laugh. So that's what you're looking for in a care community. You can bring flowers, ones that smell, and
Yes.
or a dog or a cat. And then you guys, one of the communities has pet therapy. Oh, and the zoo, not zoo. Who came in? The farm animals.
We have the petting zoo. Yep, we have the petting
Yep.
zoo that comes around to our communities, usually in between, fall and spring. And then all of our communities have pet therapy, and some of our executive directors and staff, they'll bring in their dog maybe for a week, or, skip a week and bring them in a couple times a week. And so the residents, they really love the pets, and they really love the youth too. So people that are bringing in their kids and other family members with their grandkids, great grandkids, they love that.
No. And just briefly, I mean, I mentioned hospice at the late stage, because that's more likely when they're going to have medical issues. Alzheimer's people tend to be extremely healthy for some reason. And most dementia people do seem to be physically, they might have high blood pressure, but they're diseases that you can manage with medication. And so they can live forever. And my dad was 93 and a half, and my mom was almost 91. She passed 2 weeks before her 91st birthday. And so hospice is your healthcare SWAT team. I want to emphasize this because everybody thinks it's for people 3 days before they're dying. It isn't. My mom was in hospice 4 times. The 4th time she didn't make it out, but she made it out 3 other times. It is paid for by Medicare, no expense to you. So, and it has a nurse that will have her care plan, or your loved one's care plan, has a case manager, has a minister. I mean, they literally, it's a team of people who, basically help elevate and boost your loved one's health so that they can rally and live a better life than just kind of hanging out, comatose, so to speak. So do not hesitate to use hospice
Yes.
it is a benefit to your loved ones. You only have to be 65 or over to qualify. And then they will do an assessment. But
Mhm.
if your loved one was doing great and all of a sudden plummets, they stop eating, or they aren't sleeping anymore, or they have behavior issues, put them on hospice. They'll fix it. They'll figure out a way to fix it or to address it so that you're not sitting in this panic mode of what to do next. So they're a huge resource.
Don't be
So-
afraid of hospice, for sure.
Don't be afraid of it. Absolutely. So, let's see what else we got here. So, this is something I like to leave people with, by Heather Platt. Holding space is so important for your loved one. So hold space for them. That means that you're willing to walk alongside another person in whatever journey they're on without judging them, making them feel inadequate, trying to fix them, or trying to impact the outcome. Ooh, that last one's hard. When we hold space for other people, we open our hearts, offer unconditional support, and let go of judgment and control. My favorite quote of all times. So I like to share it whenever I can. And then I'll make sure I share this with the link for the recording, there's a ton of resources available to you to ask questions. But if you're somebody who wants to talk in person, you can contact Paige at her email that she put in the chat. This is my information. And if you want to talk specific, if you have specific questions, take advantage of the free 30-minute consult, get your question answered. There's no obligation. There's no, sense of what you have to do. Just talk to me and I will provide as much insight as I can to the situation. And then you can decide what happens next. So I'm at Pam at itsnotthatsimple.com, which is the name of my book, which is available on Amazon and other outlets. But probably the best thing to do is to go to my website, and there's a ton of resources there, articles, information, etc. And that's at alzheimersfamilyconsulting.com. If you want to watch more of our videos, you can go to YouTube and then type in Dementia Caregiving Coaching, and all of our videos are there. So if you want to learn about just about anything, we have a lot on the cost and decisions for assisted living and memory care. So the person who asked that question, we actually have an hour-long discussion about that. So if you go to the Dementia Caregiving Coaching YouTube channel, you will find that there. We're working on pulling together a list of all those links and descriptions so you can have them all in one place, but that hasn't happened yet. Okay, shoo. So we made it. Does anybody have any questions? You guys have been fairly quiet, but I know, and we went through that really quickly, but it was a ton of information.
I wanted to mention just that I didn't earlier. I think it's Bonnie. If you spell it, if that's the way it's pronounced, that's a really cool way to spell your name. I like that. She had said mid to late stage is horrible, cruel disease. And I just said, yes, but you can still find love and meaningful moments. They are still in there, I promise.
Yeah, yeah. And so Gatch had mentioned moderate stage, mild cognitive impairment, I think was Karen's. I think it was Karen. So yeah, I mean, hopefully you found this helpful. And if you have, again, if you want us to chop this up and spend more time with each stage, we're happy to do that, but we need your feedback. We need to know that this is helpful to you. And if you don't want to talk about that anymore and you have another thing that you want to talk about, let us know. And again, we're here to support you and to help you make this journey as good as it can be. I think, Bonnie's probably right. It can be horrible, but it doesn't have to be all the time. It's sad to watch, but the flip side of it is that there's ways to make it a little bit better. And it all comes down to both creativity, kindness, and figuring out, working with people like us who have seen it over and over and over again. We know what works, we know what doesn't work, and we can help you try different things. But there's no reason for you to take this journey alone, right, Paige?
That's right. We're here to help you. We are your support team. So thank you all for coming.
Thank you guys for coming, and remember, reach out to us if you have any questions, and we'll see you next month at the end of September. So you'll see an email from me announcing the topic and that type of thing in a couple weeks. All right,
Sounds good.
thank you.
Have a wonderful night.
All right, yeah, good night.
Good night.